antibiotics and the side effects of the antibiotic drugs. Antibiotic drugs are the medicine that ease nausea or vomiting. A person might use an over-the-counter or the prescription version. The feeling of nausea results from the complex process in the body, and this is why the various drugs have been designed to ease the nausea in the different situations. Antibiotic drugs can help when the nausea and the vomiting stem, for example, motion sickness, viral or the bacterial infections such as those responsible for the stomach flu, pregnancy, the effects of surgery, and other medications such as chemotherapy. These medications work by blocking the chemical messengers called the neurotransmitter, which send the information about the nausea to the brain. Blocking the signals can keep a person from feeling the nauseous and vomiting. Below, we looked at the various types of antibiotics, their uses, and the possible side effects. Here we can look for the types of antibiotic drugs. Different antibiotic drugs have been designed to address the nausea stemming from the different causes. Below are the examples of this medication grouped by their purposes. Medicines called the antihistamines may also prevent the nausea and the vomiting caused by the motion sickness, and some are available over the counter. This medication desensitizes the inner ear to the motion of the head. The inner ear plays an important role in the balance, and it is sensitive to the movement caused by sitting in the moving car or a boat. For example, antihistamines that combat the nausea caused by motion sickness include diphenhydramine, meclizine, promethazine, dimenhydrinate. Each can cause the side effects, and it is important to speak with the doctor before trying the one. Antibiotics for the stomach flu. Some people with the gastroenteritis or the stomach flu need the antibiotics to reduce their symptoms. While vomiting can help get rid of any stomach irritants, excessive vomiting can damage the digestive tract. Nausea may also prevent the person from eating and drinking enough to take in the necessary nutrients and stay hydrated. The over-the-counter medication below can ease the nausea as the body fights off the infection. Sodium citrate, dextrose, and the fructose. Orthophosphoric acid, fructose, and the glucose. Bismuth subsalicylate. Antibiotic drugs can also help relieve the morning sickness. Doctors usually only prescribe them if nausea and vomiting are severe, interfering with the daily life. This can be the ease. For example, if the person has the hyperemesis gravidium for losing the serious form of morning sickness. A few medications can help, and they are safe during the pregnancy, and it is important for the doctor to carefully describe the possible side effects of the drug that they recommend. A few medications can help and are safe during the pregnancy, and it is important for the doctor to carefully describe the possible side effects of the drug that they recommend. Some antibiotics for morning sickness include the dimenhydrinate, prochlorperazine, promethazine, vitamin B6. If the symptoms do not respond well, the doctor may prescribe the metoclopramide. It is important to know that using the cannabis during the pregnancy, this is not safe and may affect the developing fetus. People who undergo the anesthesia for surgery frequently experience the nausea and vomiting afterwards. The several drugs can help, including the serotonin receptor blocker, dopamine receptor blocker, and some corticosteroids. Antibiotics that a doctor may prescribe after the surgery include dexamethasone, droperidone, granisterone, metoclopramide, ondansetron. If these treatments are ineffective, cannabinoids from the medical marijuana or other prescription drugs such as ronabinol may help. They can cause a side effects, however. Each antibiotic drug can cause a specific side effect. If it is crucial to read each drug's pamphlet carefully or speak with the pharmacist about the risk. When deciding upon the treatment to prescribe, it is important for the doctor to understand which side effects the person is more prone to experience. The following are the common side effects of the different types of antibiotics. Antihistamines, that is sleepiness, dry mouth, and the dry nasal passages. Bismuth subsalicylate, black stools and changes in the tongue color. Cannabinoids, an altered state of perception and the dizziness. corticosteroids, they are indigestion, increased appetite or the thirst, and dopamine receptor blocker, fatigue, constipation, ringing in the ear, tremor, restlessness, and the muscle spasm. NK1 receptor blocker, they are tremor, reduced urine volume, and the heartburn. Serotonin receptor blocker, fatigue, tremor, and constipation. A complication, the antiemetics can help people live without the nausea and the vomiting, but they can also cause the side effects and the interaction, some of which can be severe. Alert a doctor if any of the following occurs, like muscle weakness, spasm, or the convulsions. Changes in the heartbeat such as palpitations or the rapid heartbeat. Hearing loss, worsening of the nausea or vomiting, slurred speech, psychological problems such as hallucination and the confusion, drowsiness that interferes with the daily life. It is important to discuss the options with the doctor before trying any antibiotic, especially for the people who take other medication. For instance, anyone who takes a sleep aid or the muscle relaxant should consult a doctor before taking an antihistamine for the nausea and vomiting. Also, taking an antibiotic and another medication that can cause the similar side effects, which may result in the worse and unwanted side effect. Medication with the similar side effects include the cold medicines, aspirin, medicine for arthritis, medicine for diabetes, blood thinners, and medicine for gout. Natural antibiotics. Some natural options exist for the people who prefer to over the drugs. Ginger, this is the traditional remedy for the nausea and an upset stomach. Ginger can help the morning sickness and alongside medication to nausea and the vomiting from cancer treatment. There is not enough evidence to say whether it can use the nausea caused by the motion sickness or the effects of anesthesia, however. Meanwhile, there is some evidence that peppermint, lavender, and the lemon essential oil may help with the nausea. Antiemetics, they are the drugs that combat the nausea and the vomiting with the different drugs designed to address the specific causes of a nausea. Anyone who is unsure whether an antiemetic may be helpful should speak with the healthcare provider or the pharmacist. This is crucial for the people who take other types of medication. Thank you.